Good afternoon, everyone. Some of you may know who I am. I'm one of the pharmacists that work alongside with Dr. Lynch and Dr. Thuringer. And today I'm just going to do a short presentation on Evusheld. This is a medication that came out more recently in the last couple of months. I feel like some people may still not know about it. Some people, because it's gaining popularity, know a little bit more. So just wanted to give everyone a general overview because we've been getting questions and trying to, one, inform you guys so we can kind of prevent questions, and two, kind of if you're interested in it or know a little bit about it, kind of have a better idea of how KU is going about deciding who's eligible for this medication, as well as who could receive the medication. So first off, what is Evusheld? If we don't already know, Evusheld is a long-acting monoclonal antibody, and it's just for the prevention of COVID-19. So it's not for a treatment, so not if you have COVID, and it's not post-exposure, so not if you've already had COVID. This is just for patients who are eligible who've not had COVID-19 to prevent that. It's been shown to show up to last at least 6 months. There's not a ton of data yet. It still is new. And so we're thinking at this point that it may need to be redosed about every 6 months. That's kind of the general guideline that they're placing out there, but I think we'll know more information the longer that this medication is out. It didn't go through the full FDA approval process. It went through the EUA process, or the emergency use authorization. So that's the same thing that our original COVID-19 vaccines went through, until the majority of them eventually, about a year or so later, got through the whole FDA process to go back and get FDA approved. So this EUA is essentially telling us that from the data that we have, it's saying that the medication benefits largely outweigh the risks. There's nothing else on market to date that is used for this use. And because of the pandemic crisis that we're in, that's been shown to be beneficial, that they gave it an emergency use authorization. So it was specifically approved for this pre-exposure prophylaxis of COVID-19 in certain adults and pediatric patients. So these are people, like we talked about, that are not currently infected with COVID-19 and have moderate to severe compromised immune systems. And this can be due to certain medical conditions, or if you're taking specific immunosuppressive medications that suppress your immune system, which can be some or all of us. So that's why I'm here today telling you a little bit about it. Or you could have a history of a severe adverse reaction, not to any vaccine, but specifically to our COVID-19 vaccine. And that could be any of the three, or I'm sure, who knows if we'll have more coming. So how does it work? The way that this works, I just kind of gave you a fancy graphic, is it specifically, for the fancy words, it targets against the spike protein of the COVID-19. So if you if you look over here at my picture, the little blue ridge, that's like your cell. Those little spiky pink things, that's like the COVID-19 virus. And when we get infected with the virus, it tries to enter into our cell by latching on to one of these little type receptors. And so it latches on there, and once it latches on, it goes into the cell, and that's how we get infected. So the way that the Evusheld works is, if you can see that little red X on that middle one, it actually prevents the virus from entering the cell because it prevents it from latching to the receptor. So that's how it's designed to block the virus from entering into cells. There are two different types or worker horses in this Evusheld, and they bind to different sites. So we're essentially using two different monoclonal antibodies to stop the virus from entering cells at different receptor sites. And when they did the studies, it was a small study because we talked about how there's limited data, but there were about 5,000 people, and they had, it was a 2-to-1 ratio. So they had 2 people on drug for every 1 person who wasn't on the Evusheld, and they showed a 77% risk reduction in symptomatic illness. So those people who had gotten the Evusheld, they had 77% risk reduction to the COVID-19 virus. This is just another depiction, specifically what they have in the drug information packet of how it prevents the COVID-19 from entering your cells. But that little purple and that little blue Y-shaped thing, those are just depictions of how those two different types of monoclonal antibodies that are inside this Evusheld drug that are preventing entry into the cell. So how is it administered? It's administered in 2 separate intramuscular injections, so into our muscle at different injection sites. The information that we have right now says it's preferred to give in the gluteal muscle. And so I showed that little purple shot right there where that area would be, and typically 1 on each side, so at different injection sites. After we give this injection, we have to monitor the patient for an hour to make sure that there are no injection site or adverse reactions from the monoclonal antibody injection. So people want to know, what are the adverse effects? Mainly what we see with this medication is headache, fatigue, and cough. I put the percentages right there in the information that we have so far. There about 6% of people had a headache, 4% fatigue, and 3% cough. Like with any sort of medication, there was hypersensitivity reactions, including anaphylaxis. This was low, less than 0.1%, but it was still there. We do give this with caution in people who have bleeding disorders. So certain things called thrombocytopenias or coagulation disorders. This is something that if you have one of those, we'd have to speak with a physician. You'll also see later on that some of the criteria is to have a certain number of platelets. The platelets are those things that help us stop bleeding. And so we'll talk about that, as that's a stipulation to start on this Evusheld. And then the other side effect that was more notably was cardiac events. So this number was still pretty low, but when we looked at patients who did not receive the Evusheld and people who did, there was a slight increased risk for cardiac events that included heart attacks as well as cardiac failure. Some of these people were people who had previous heart attacks and things like that. But you can see the percentage there was 0.6%. People who had Evusheld had one of these versus 0.2% in placebo. So there were cardiac events in both groups, but a little bit more in the Evusheld group. So that's something to think about. So when we're talking about Evusheld at KU, what does that look like? What are we doing here? We essentially, when this kind of came through and was met for EUA, we put together a Evusheld task force. This is including anybody who's been working with monoclonal antibodies here at KU, as well as our ID physicians. Some of the criteria that was laid out for us from our physician teams as well, and our pharmacists that are on those teams as well, but also from the package insert or how this medication got approved, was you have to be at least 12 years old. You have to be at least 88 pounds. You can't be currently infected with COVID-19, and you can't have any recent exposures within the last 14 days. And you have to have suspected inability to mount an immune response from a COVID-19 vaccine. And we are not requiring a negative antibody test. And then the other thing we talked about earlier, that platelets, we have to have a platelet level of greater than 30,000. That, along with specific criteria on immunocompromising conditions as noted in order of priority. So what does that mean? So we essentially had a team sit down and say, what medications, what medical conditions could our patients have documented in the chart that would make them eligible for this? And I'll give a little bit more detail on that so everybody it's a little bit more transparent of what that means. So when we talk about how this medication is distributed, it's very low volume, and it comes from the Kansas Department of Health and Environment. So with that being said, we don't always know how much of the drug we're getting, and we don't know when it's getting. It's usually allocated on a weekly basis. We're in hopes that the more that we use, the more that we will get, because they know that we have more patients that are eligible that we're utilizing it for. But those amounts are kind of what I'm going to say is we can predict, but it's never a for sure thing. So we don't always know when we're getting shipments. From the Evusheld task force, when we found our patients who are on the certain immunocompromising medications that have suppressed the immune system, or they have medical conditions that puts them at increased risk, What we did is there is data that got pulled from the medical system that gave us a huge group of people who may be eligible for the Evusheld. And then these people were placed in a lottery system based off of tiers. So kind of once we got that big group of patients that are on our medications that suppress the immune system or have those conditions, we put them in different tiers, 1 through essentially 5, with patients who are at highest risk first. So those highest risk patients may be people who are have certain medical conditions like bone marrow transplants. They may be also certain people who are on certain medications that we know for sure, like anti-CD20 medications, that for you in real world would be something like Ocrevus or medications like that, that we know that we have good data that shows us that those people, if they received the vaccine, likely did not mount a response to the COVID vaccine. So essentially tier 1, like I said, is highest priority or highest risk. Patients who fall into one or more of these categories, they get put in that higher tier. So if you have somebody that like qualifies for a tier 1 and a tier 3, that person goes into tier 1. And any person within that entire tier gets the same chance at getting the medication because it's a lottery system. So everybody is kind of, once you're in a tier, everybody has an equal chance. This medication is being given in our Sutherland clinic on main campus, so it's given centrally. And I just kind of put together a little step-by-step fashion of what we're doing for the workflow. So each of us clinics developed criteria for our eligible patients. So I sat down with Dr. Thuringer and Dr. Lynch. We came up with a group of patients that we could think of based off of medical conditions or medications that we thought, hey, these people could be at really high risk for getting COVID, and their body probably didn't mount a response to the vaccine. That information was given to our data pull team, and essentially our IT team pulled out information from the medical chart, which is probably your prescription or from your chart notes or your diagnosis, that put patients into our categories. From there, all of our patients, like I mentioned, were placed into those different 5 tiers. And then we're doing a weekly lottery system based off of how much medication we get. And how that's going to work is we lottery it. So we first start off with tier 1, and we do a lottery system until every single person in tier 1 has been offered Evusheld, not necessarily gotten, but offered to see if they want it. Once we have spoken to all of those people and had enough medication to meet all of tier 1, then we transition to tier 2. So all of us clinics provide a list of patients. If we think that a patient might have been missed for some reason through the data poll, physicians can also individually enter in patients so that they can be selected into a tier. And then once we have patients, let's say we've got, I don't know, this week, let's say we had 2 patients that were in tier 1 that got selected through the lottery system. Our clinic would be notified of those 2 patients, and then our staff would be reaching out to those patients saying, hey, this is what Evusheld is. You qualified for it. Would you be interested in receiving it? Kind of running through the baseline questions, making sure you hadn't had exposure to somebody in the last 14 days, all of that good stuff. If you decided you wanted to receive it, they would then help you schedule an appointment to receive the medication in that central Sutherland clinic. And this is a lot of information. It's really tiny. I just wanted to give everyone a good idea of what these different tiers looked like, what types of patients or what types of medications were in these different tiers. And I highlighted some that may specifically correlate with our group. So the ones that I highlighted in tier 1 is anybody who's within 1 year of receiving B-cell depleting therapies. So that's Rituxan or rituximab, ofatumumab, which is Kesimpta, alatuzumab, which is Lemtrada, ocrelizumab or Ocrevus, and then enulizumab. Any patients that are receiving, people call them BTK inhibitors or Bruton tyrosine kinase inhibitors. We do have some study drugs or some open trials right now that are including these medications. So this is some of our patients as well. Anybody who's receiving a S1P modulator. So this is Gilenya or fingolimod and all of its sister medications. So Ponvory, Zeposia, and Mazin. So any of those medications. And then patients receiving cladribine, that's Mavenclad. So they listed all of the generics, but hopefully some of those brand names I threw out sounded familiar. So anybody who's had Mavenclad within the last 6 months, those are all people who are in our tier 1. People that are in tier 2 or anybody who's received Cytoxan or cyclophosphamide within the last 6 months. And then some of these other I'm going to say other specialties kind of categorize these as DMARD or DMT agents. We're DMT, so those disease modifying therapies, mycophenolate, methotrexate, azathioprine, that we see a lot of. Eculizumab, we see some. Any of these listed medications that I've got here. Infliximab we use, tocilizumab we use. This is kind of some of those sorts of medications. Some of these are for NMO as well. And anybody who's on high dose steroids, but that's 20 milligrams per day of prednisone, or something equivalent to that for greater than 14 days. Those people are eligible here in tier 2 as well. Move into tier 3. We have more prednisone use, which we use a lot here in our clinics, as well as some of our other medications. And there's some other conditions I put here. So cancer, heart failure, lung disease, pregnancy, diabetes, obesity, and mycophenolate is here as well. Tier 4, here's essentially the rest of our DMTs aside from them, without additional immune suppression or comorbidities. And then here's tier 5 is essentially have a medical contraindication to the vaccine without any additional risk factors. So going through those tiers, you can kind of see we put it from highest risk medications as well as other comorbidities that may put us in increased risk or other medical diagnoses. A couple fun facts is it can be administered 14 days after a COVID-19 vaccine. So if you'd recently gotten a vaccine or a booster, Evusheld can be administered 2 weeks after that. It's not a substitution for the vaccine, and they're still recommending that you get vaccinated for COVID-19 if you haven't already. But this is essentially in addition to, and we talked about this, but it's not for after you've gotten COVID or the treatment of it. And it is active against Omicron. So that's a big question that was happening just because it's one of the variants that we're seeing right now, especially we saw recently with our surge.